We will get to the next phase when Australia reaches 70% of the eligible population who are double dose vaccinated. Because once we get above those 80% marks, the scientific evidence shows that we're largely then in a place where COVID can be managed consistent with other infectious diseases.
You could be forgiven for failing to keep up with every COVID statistic that's thrown at you. The key here is to understand the percentages the Prime Minister quoted on Friday. His 70% figure takes us to the next phase, which is about minimising the impact of COVID with low-level restrictions. But it only takes into account Australians over the age of 16. The more useful number is the percentage of the whole population that needs to be vaccinated to live with COVID and open up again. 70% of the eligible population is actually only 56% of Australians, which is where the UK is at now.
In Sydney, even though we're very worried about these 200-300 cases a day, that is not a lot of cases compared to what we've seen in the UK and in the US. So it is not too late to bend that curve in Sydney and drive down cases with public health measures and with vaccination.
We'll have to accept some community transmission when we eventually open up. Professor Emma McBride has modelled various vaccination scenarios and believes we need to adjust the rollout to get the most out of our vaccines and slow the spread.
We looked at whether we should be targeting the most vulnerable people in society, which is mostly the elderly, and we found that under almost every circumstance you target the most vulnerable, and that's great because that's what Australia's been doing.
This is the proportion of deaths in an unvaccinated population. See how that falls with 60% and 80% coverage. The question is, do you then just vaccinate progressively down the age groups? Professor McBride doesn't think so.
Once you've covered the most vulnerable people, the next group is the transmitters. And at the moment, that's sort of your late teens to about 30 or 40, the very group that are sitting around waiting for their Pfizer dose right now.
This is something which, for other reasons, is partly happening in New South Wales already.
The New South Wales government will be vaccinating students 16 to 18 years of age who are in Year 12.
For the first time in the pandemic, we're adding vaccination to the mix of measures to get an outbreak under control.
Let August be the month where we break records in vaccinations, because that is our ticket to freedom.
That ticket to freedom in New South Wales and beyond New South Wales now rides on how fast our vaccine rollout happens.
We haven't put timelines on this because the timelines are now in the hands of all Australians, together with state and territory governments and the federal government. We get there when we get there, and I hope we get there as soon as we possibly can.
Australians have so far received more than 12 million vaccine doses. On a rolling average, 1.2 million doses are being administered each week. If that average doesn't increase, we would expect to fully vaccinate Australia's adult population by early January next year. The variable in all this is what happens in New South Wales in the next 2 months and whether the state can get back to zero spread.
My prediction is that Sydney won't drive cases down to zero, but what it will do is maintain a small number of cases, and by small I mean a couple of hundred a day or less, for another couple of months. And by then, the rest of Australia will have sufficient vaccination and be in a position where we no longer concentrate on cases and we start to look at hospitalisations and deaths. And then Sydney will join the rest of Australia at that point.
But will the rest of Australia be ready to open up to New South Wales? That will be as much about politics as following the scientific advice.
We need to have a plan B. I don't believe that we should have thresholds that mean we have herd immunity before we open up, because what that means is we have zero tolerance for any COVID transmission at all, and I think that's unrealistic. And it's going to keep us in lockdown for much too long.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.